So this is essentially family, since we're all Lions members. And so it's a little bit more relaxing for me. Last night I had to present to the CEO of my hospital. That was a little bit more stressful. But you know, today I'd just like to thank you for the invitation to be here. I have to say Ventura is gorgeous. I'm driving up here and I was telling Amy on the way in, I don't know why anyone continues on to Santa Barbara. Just stop here. Yeah, so anyways, thank you. It's a wonderful venue. I will say the Glendale chapter doesn't have a venue this nice. But anyway, having said that, I'm really grateful to be here and have the opportunity to speak with you and tell you a little bit about some of the projects that we're working on that you are supporting and why that is so important for the children of Ventura. Oh, great. So we're doing the next slide. We'll start off with where the Lions came from and one of the reasons why vision is so important. It goes back to Cedar Point, Ohio. And in 1925, as you know, Helen Keller was asked to speak in front of the Lions and give you the charge that has become the mission of our organization, which is, I appeal to you, Lions, you who have your sight, your hearing, who are strong, brave, and kind. Will you not constitute yourselves knights of the blind in this crusade against darkness? And ever since 1925, that has been a hallmark feature of our organization and why it is so important for us to continue that history, that legacy forward in the future. And when I say future, I mean really the future. So we're going to talk a little bit about that. Next slide.
Newcomers also come to the
An
play.
example of what.
Do you want me to play?
Yeah.
Okay.
No, hang on. Go back. So
Newcomers also come
this
to the
is
play.
what we see with our eyes, our normal eyes. Children have every right to see this, but some of them may actually have conditions that prevent them from seeing clearly. So this is what a child with ambivalence. This is what a child has cataracts can see. This is a child with glaucoma. And this is what a child will see like in advanced retinopathy prematurity, which you helped us investigate. Some children
The northern flower end is mirrored by the grasslands of the southern hemisphere, and nowhere is more impressive than on the veldt of South Africa.
So, before we work, I used the arrow key. So, for us, our goal is to make sure that children, who are the most vulnerable part of our society, have advocates out in the community to make sure that they will be able to see all the things that we would see on a day like today. We were just talking about the venue, the ocean, the palm trees. That's not something that our children take for granted because they're at high risk for losing that sight. Yes. So this is what children in our world live on. This is where they live. They live on the internet. They use Facebook, Google, Pinterest, Twitter, Instagram. From a workforce standpoint, you have to use Microsoft Word, Excel, use the internet. Not all of our children who come through our doors actually can take that for granted. Many of our children are going to be at risk for never being able to use anything that you see on the screen ahead. Thanks. So, we want to avoid this future for those kids. Now, just a couple facts. Go ahead. A couple facts about blindness. Next one. Somewhere in the world, a child goes blind every 5 seconds. So I've been giving this talk for 3 or 4 minutes. So that's about 50 children who've already gone blind somewhere in the world since I started this discussion. Thanks. Globally, about 7 million people will go blind each year. Next. This has an impact not just on what we see around us in terms of the beauty of the world. This actually has an impact on their education. 85% of what a child will learn is going to come through vision, and children who don't have vision, the rate at which they will graduate from high school is much, much less. Next. The economic impact follows that, meaning that the average unemployment rate is about 55%, and the jobs that are available will be very restricted in terms of what they can do. So there's an economic component to this. It's not just how we feel about it, it's affecting our society. Thanks. The good news is that about 80% of childhood blindness is preventable if diagnosed and caught early and the appropriate treatment is initiated by someone who has expertise in that specific form of blindness. So this number 27 represents the number of different ways a child can go blind at birth. And the eye itself is extremely complicated. This is why there's so many different ways that this can happen. And unlike other parts of the body where if you're an ear, nose, throat doctor, you can pretty much handle most of the things that would come into your office. For the eye, because of how specialized it is, you need to actually have someone who specifically focuses just on the cornea, or just on the lens, or just on the retina, or just on the aqueous production, or just on the optic nerve, or just on tumors. So you can see that children who are at risk of going blind need to get to the right person and have access to the right level of care at the beginning. They cannot go to an adult ophthalmologist and expect to get the same level of expertise and care because children are not small adults. And the ways they go blind in childhood are completely different and are treated completely different than an adult. So an adult who has glaucoma will get a very specific procedure. A child who has glaucoma, which is elevated pressure in the eye, if that same procedure, which works so well in an adult, is done on the child will go blind. So it's really important that we address them with people and doctors who are really focused on these different forms of childhood blindness. So I'm based over at Children's Hospital, Los Angeles, just a little bit south of here. Next. And at our hospital, we have 8 full-time surgeons who each focus on a different part of childhood blindness. And because of that, we're the only facility, we're the only facility in the country with this depth of expertise. We're one of the largest centers for childhood blindness west of the Mississippi. Next. And these are some of our other doctors who are optometrists. Next. So I'm going to take you a little bit into the future, what I see as my future. And if you go to the next slide, this is what I see. This is my future. Lots of babies. Lots of babies. Not me personally, my babies. I'm good, I'm not that good. But these are a lot of kids. And these kids look so cute. They look so adorable. These are kids you just want to scoop up and hug, right? From a healthcare standpoint, one of the biggest hurdles we face in healthcare is a concept called access. How do we take all the children and give them access to the level of care and expertise they need? So when I look at all these babies, I don't see cute kids. Next slide. This is what I see. I see a future where I'm trying to figure out how am I going to care for all these kids who are at risk of going blind. How do I get them into the system? How do we make sure they get partnered with the right groups? And so this creates a lot of anxiety and stress in me. Next. So what do we do then? Well, we set up satellites. So our hospital sets up satellites that allow us to reach out to the community. I drive out to these satellites. But as you know, driving in LA is sort of a precarious proposition. And in fact, I was just telling Amy on the drive up, I was going up the 101 just inside the city, and all of a sudden, about 100 yards in front of me, I see some police lights going off. But the police lights are going like this, going back and forth. Have you ever seen a signaler as it's happening? Yeah, so that was on my drive up today, and I was about 100 yards behind what was evolving into a sigillard. And so I immediately got off. I was telling Amy that pattern strikes visceral fear inside me that I'm on the road. And so I had PTSD from a previous sigillard. So but that Friday is not trivial for us. And so this is not a scalable model. This helps me address a small group of kids, but not make sure that kids anywhere can get into us. Next slide. So we're really talking about how do we deliver healthcare? How does that happen? And this is how healthcare was delivered 100 years ago. You had a doctor, you had a patient, and you had a room. Well, now it's 2016, and we're talking about modern medicine. And so this is how healthcare is delivered today. Next slide. Doctor, patient, in a single room. That is not a scalable model. So, how are we going to address all these kids who we know are at risk of going blind, who have not even been evaluated yet? Next. Do we just say, well, that's how it's always been done, and that's how we're going to do it, and that's how my teacher did it, and that's how his professor did it, and that's how my doctor did it? Or are we going to try and do something differently? So we're going to take a deeper look into that future. And it's going to require us to rethink how we take care of patients and reach out to children who are at risk of going blind, and also other conditions as well. So next slide. So that future of medicine is going to come from Netflix. How many of you have a Netflix account? Okay, great. How many of you watch House of Cards? All right. So how many of you have an HD TV? Okay. How many of you have gotten permission from your spouse or your wife to buy a 4K Ultra HD? Of course, it's the person who owns the Arcade Center. So, why is Netflix the key to medicine? Netflix is the key to medicine. Next slide. Because House of Cards, next slide, is filmed in 4K, meaning 4 times the resolution of high definition, so ultra high definition. And with all of their original content, Orange is Black, House of Cards, and all the other stuff that they're producing, they're future-proofing that content by filming it at this ultra high resolution that they can stream through your existing bandwidth, through your existing cable box. You don't have to buy ultra-fast internet to get this, because they figured out how to compress the video signal so well and so efficiently that they can stream it over your standard cable modem. Next slide. And what we're seeing is the speed at which you can get onto the internet goes up and doubles every 18 months. Okay. So, next slide. So this is a still frame from a child who's looking out a window, and that still frame is coming from a video filmed at 4K. And this is, again, the resolution that Netflix is now pushing, and it's setting as the standard across all the different streaming platforms. This is what that resolution allows us to do. Next slide. That 4K resolution allows me, and this is not what we would normally do for medicine, we would do that just to be even better, but that, you can actually look at the reflection of the child's eye and tell that that child is looking out a window. And you can tell that that window has 9 panes of glass, or 12, depending on how you count. You can see the individual eyelashes. And that's taken from a cinema camera that's not even designed to look at the eye. And that's going at 30 frames per second. And that can be streamed into your cable box. So, next slide. And hopefully this will work. Yeah. So I'm going to show you an example of how this is going to work.
Childhood blindness is a global concern. Even in the cosmopolitan city of Los Angeles, newborns have a 2% risk of visual impairment, and there are not enough surgical ophthalmologists to treat the area's 3 million children.
Because of the level of expertise of our physicians at the Vision Center, over 70% of the complex cases within the greater Los Angeles area will we referred him to Children's Hospital Los Angeles for a higher level of care. That disproportionate burden being placed on the doctors presents a real challenge and compels us to find new ways of delivering care in the 21st century.
A telemedicine program linking remote sites via high-definition video is being piloted at the Children's Hospital Los Angeles Vision Center, an affiliate of the University of Southern California Eye Institute.
If we were to actually have each physician drive out to each of the satellites, we'd be spending 10 to 12 hours a week on the road. 10 hours I'm not seeing additional patients here at the main campus. In that time, I could see easily 50 patients over the course of a week. Short of cloning ourselves, we have to innovate our way out of this box, and that's really through technology. The field of ophthalmology has relied very heavily on the ability to image and see the structures of the eye. We've been a big beneficiary of all the new technology coming out in terms of high-definition cameras and the ability to stream that signal, to the point that much of the equipment that we use to look inside the eyes now have high-definition cameras embedded in them. We can actually beam into the main campus to look at and examine the patient who is 30 miles away. We can actually stream the signal in real time to a remote physician and allow that doctor to make a diagnosis and assessment.
The program presents enormous possibilities globally, but is already making a significant local impact in Los Angeles.
You know, Jason, I know the referring doctor was concerned about strabismus and possible amblyopia, but looking at the exam, told the father that his daughter's perfect and that everything should be fine. But we had a child who we were taking care of in Bakersfield. That child ended up having a very devastating form of childhood blindness called retinopathy prematurity. The baby was imaged with a camera that was specifically designed to beam to the internet. I looked at it, and this child had such a profound state of disease that I knew that we had to get to that child immediately. The child was sent in an ambulance urgently that night. The next morning, I saw the child in my own ICU here at the hospital, and then initiated a treatment that basically saved that child from going blind. And now the child has a very good shot at having perfect vision.
The results for this pilot program are so promising that the Vision Center hopes to soon cut in half the number of cases of childhood blindness in the city of Los Angeles.
Let's leverage what we already take for granted on our phone and use that to save a child from going blind. So that's just a peek into the future that we can envision and imagine that's actually happening right now. And it's happening right now because of the support of your Lions Club and your chapters. We're going to talk a little bit about that. Next slide. So we are doing a version of what we call telemedicine, specifically with the neonatal intensive care units, using the platform, the camera that you just saw at the end of that video. And it allows us to reach out to not just Ventura County, not just to Bakersfield, but now to Phoenix, Arizona, where they also are in need of high-level care. Next one. Here's an example of what we're doing now that goes beyond that. And this has been an internal pilot within our hospital where we have our doctors evaluating children, quote-unquote, remotely, but really it's just in a different part of the hospital to test this out. So you're going to see, next slide. So this is actually a patient exam done a couple days ago.
So I checked her vision with the Snelling. She has on the right eye 20/40, minus of +1 +1. On the right eye without lenses. Without. With the left eye, she had a 20/50 +2.
What is she doing in school? Is she?
Oh, she's flourishing. She is good in school. But not to mention that we don't even speak English at all.
Like, Jesus, look at my monster here. Good. Macula looks fine. Everything okay?
Everything, her brain was fine.
Yeah. Good.
Okay.
Great. Don't look at the monster. Can you see it over there? Okay.
So that child was actually diagnosed with a brainstem tumor based on this remote exam. And had that child tried to get into us with the normal mechanism, would have had to wait 3 months. So that's where we're headed as an internal pilot. But we're really, really interested in taking this to the next step to other children. Next slide. Because we know that, recognize that there are children who may not actually be within driving distance or convenient driving distance of our hospital, maybe even halfway around the world. And so the question for us is, how are we going to reach out to them? And I think the most important thing for us is finding the right partner to try and take this outside of our hospital walls. And when we looked at different locations, Ventura for us was actually a really attractive site. It was attractive because it was far enough away that if a child had a problem, the barrier going from Ventura down here to LA would be just enough that it might actually be a barrier. But it wasn't such a far distance that if there was a real high level of care they needed, it wouldn't be too far for them to come down. So it was sort of a sweet spot. So we knew that Ventura was an attractive area in terms of a potential partner as a city. But then we had to find a potential healthcare partner. And for us, we're very focused on children and making sure all children have access. For us, we're what we refer to as a mission-driven hospital. We're not Cedars, where we have a lot of celebrities walking to our door. And UCLA, as great as it is, has limited capacity, so they actually don't see a lot of kids. So we had to find a similarly minded, mission-driven healthcare institution, hospital, that shared the same values that we do, which is that the most important thing is the child. And if they have Medi-Cal, private insurance, whatever their insurance status is, that's secondary. We want to get to the child. And when we first started exploring this, there was one name that came up repeatedly, which was Ventura County Medical Center. And the head of that pediatric clinic, Dr. Chris Landon. And when I met Chris, so the story is I actually spoke to Chris probably 3 years ago. And 3 years ago we didn't have this technology. But Chris, Dr. Landon, was very excited about telemedicine. So he called me up and said, "Hi, my name is Chris. I'd love to do telemedicine with you so that you can take care of all of the patients we have in Ventura County." And I'm back in my home institution, I'm thinking, I already have a 3-month wait for kids to get into my system. Why would I want to take care of your kids and double my wait? And he says, no, but telemedicine's great, we gotta do this. And I said, well, let me think about it. And I hung up and I'm like, that man is crazy. He's totally crazy. And so for 2 years passes. And then all of a sudden, I'm like thinking, this telemedicine thing is great. I can go out to all these sites, I can help them service all their kids. This will be wonderful. Because the technology finally caught up to the vision that Dr. Landon had 2 years before I got a clue. So when that happened, I started thinking, well, now we have the city identified, and now we have a great partner who shares the same value systems as we do, who's really concerned about taking care of the child. And now we just have to find a third partner, someone in the community who shares the same values and the same mission, especially around childhood blindness. And that's what brought me here today. The Lions Club is such a well-respected and carries a lot of, reputation. It has a stellar reputation in the community. And it's because of what you've done historically and what you're doing today that I can tell what's going to happen in the future. So by bringing together Children's Hospital Los Angeles to partner with Ventura County Medical Center and partner with the Lions Club, I think you have what we refer to as best of breed. You have the best parties that are coming together around a common mission that is all deeply to the core of who we are. And so for that, I'm incredibly grateful and excited about where we can go in the future. Your support is helping us establish our first telemedicine outpost with an external partner, and that was not by accident. It's because of all the high qualities that everyone brings to the table. I will say that when I have these discussions within Ventura, and I mentioned that the Lions Club of Ventura County is one of our community, is our signature community partner, people are like, oh, that's really great. And it provides us with credibility and legitimacy because your organization is backing and endorsing the future of how we can take care of kids here in Ventura County. So I'm going to end on my favorite proverb, which is, it's an African proverb actually. It says, if you want to go fast, go alone. Next. If you want to go far, next. Go together. And I really think that that's really summarizes why I'm here today. I think by coming together, bringing together these three incredibly powerful organizations to rally behind childhood blindness, we can scale a mountain that I wouldn't be able to do by myself, that VCMC couldn't do by itself, but with you, we can do that. And next slide. And of course, I feel strongly because I'm a Lions member as well, and that's why I joined the organization, because I think the values and the mission of the Lions is really, really key to ensuring childhood quality of life through their vision. So thank you very much. So I guess questions?
I asked if we had time for questions, and I see a hand go up, so let's start.
Yes.
It's not really a question, just more of a statement of thank you. I've heard it said that lions are one of the best kept secrets. And your presentation today, I don't think I have personally felt more proud of the lion than I have right now sitting here after your speech. So thank you.
Good job, Joey.
Any other questions? Yes.
What is the future after this future?
So Ventura is actually really important for this roadmap, and the Chief Medical Officer of the Ventura County Healthcare Association and what we call CCS, Child Specialty Services, is very, very interested and curious about where we go with this. Because their concern is that there are going to be these children who, as healthcare evolves, we need to figure out ways of getting them plugged in. And I will tell you, to run my shop of doctors is probably north of $2 million each year. And for Ventura County to do that in duplicate would be a really expensive proposition. So they're trying to figure out ways of how can we partner with the existing doctors here to provide it. So if this works, then the next step is to look at pediatric urology and other ways that our two hospitals can partner around this common mission. It could be pediatric ENT, we already do pediatric cancer in concert with VCMC. So our goal is to use the technology, prove it on vision with the Lions Club, and then that same platform, that same cart, can then be used for other disciplines to take care of other types of childhood illness. Great question. Yes?
Good to see you again, Dr.
Yes.
Lee. Basically, it was Andy that brought this partnership and need to the table, and then we did immediately form a committee that enabled us to get that retina camp shuttle taken care of? I know this is a very broad question. What is the next step for us to go to the next level?
Well, I'm gonna have Amy join in on this, but we're very excited about getting a fully equipped telemedicine card into VCMC. And we're actually, one of the things that comes up with these is a training program. So using this equipment, it's all the pieces are pretty standard, but how to use them is slightly different. And so we're actually very interested in how do we train more healthcare practitioners, eye care practitioners, optometrists, how to partner with us. So I think first comes the actual physical components and put those pieces in place, like the telehealth part. And Amy can give you more information on how that breaks down in terms of cost. And then training. You know, I'm a firm believer in you shouldn't just give someone, because the parable is, if you give a man a fish, you feed them for a day. If you teach them how to fish, you feed them for a lifetime. I'm much along the latter side. And so I would love to be able to train people on what child compliance is, so that they stay in Ventura County and can be even more effective partners for us in managing your children. Yes?
This isn't a question. You gave us such a good compliment. I'd like to give you one. 22 years ago, my 3-year-old child was diagnosed with cancer, and we were told we had to be at Children's Hospital the next day. Never heard of it before, didn't know where it was. Had to get a map to find how to find your hospital. But with the grace of God, in your hospital, he's now 25 years old, math graduate, and we never met him. We met the best nurses, best doctors. They know how to treat children, and I thank you for the rest of my life.
Thank you for those kind words. You know, our hospital is very focused on taking care of children. The reason I bring up the insurance issue is that 7% of all children in Southern California are underinsured. They're on Medicare. And we are a private hospital. We don't get state support, but our doors are open so that all children can come in and be seen. And it's our firm belief that if you only take care of the 30% that have commercial insurance, you do not become the best. And it's not that I'm a big one of being the best, but I'm a firm proponent of being the best possible doctor for that child. And I think when you do take care of all children, you become very familiar with the needs of not just that child with the disease, but the family and everything else that goes around that. And I think that's why being mission-driven as a hospital and part of the VCMC is so important to us. And you know, we happen to know, because of that long-standing partnership, we now have the expertise in Ventura at VCMC to take care of pediatric cancers in an agreement or relationship where our pediatric oncology department partners with VCMC to have the chemotherapy delivered right here using the protocols that we have done on children. So I think the evolution of this relationship of our hospital to your children continues to evolve. And I think what's so wonderful about this group is we are now about to launch it into that totally new next level, which is where we can actually do this all significantly over the internet. And that's going to be a Lions Club initiative. That's going to be you are going to own that project. And I think the ability to envision that completely next step of how we take care of kids is really, really exciting. And you know, thank you for those kind of words. All right, well, thank you so much.